You know, getting a handle on COVID-19 and driving down the infection rates is multi-pronged. So while state government and the Primary Healthcare Development Agency continue vaccination across the country, there are simple things you can also do to contribute to the collective response. I mean, just yesterday, the National Social Behavior Change Campaign on COVID-19 in Nigeria was launched, and the central message is stopping COVID-19 is in your hands. But what does that really mean? Let's break it down for you on the program. We have joining us from our Abuja studio, Dr. Yaya Disu, the head risk communications at the Nigeria Center for Disease Control. It's great to have you on the program, Doctor. Well, this campaign, I understand, is a result of surveys.
Thank you for having me.
Great to have you. So I understand that this particular campaign is a result of surveys that have been conducted, and the Nigerian context is quite peculiar. I'm sure you can attest to that. So what would you say first is the edge that this campaign has in driving home the message and encouraging compliance compared with others which we've had?
I think you have known that COVID-19 pandemic has evolved in phases, and so also the responses have also evolved in phases. There was a time we were talking about non-pharmaceutical intervention, and then at the same time, after a while, we started talking about vaccination. But then we have not stopped talking about compliance with non-pharmaceutical intervention. And then the reason is for vaccine to be, for the COVID-19 to be put under control, we need public health measures, public health interventions. Simple things, cost-effective interventions like hand hygiene, physical distancing, and so on. And then, but it seems Nigerians are getting tired, and probably they feel that we are getting too familiar with COVID-19, and then because of that, they don't take those actions again. And then, but then, what is happening globally, and then we have seen surges that is moving from country to country, and then it has happened in countries that have similar conditions with Nigeria. So we don't want that to also happen. So we have to rejuvenate the campaign, that is Take Responsibility campaign, in form of how you can stop COVID-19 with your hands. HANDS is actually an acronym for those key messages, and then they are supposed to drive long-term behavior change. H stands for have your hands washed always, while A stands for always cough or sneeze into your elbow. Then the N stands for, that is, then no going out without a face mask, while D stands for distance of at least 2 arm lengths must be maintained, and the S means stay at home when you feel sick, or you isolate yourself. And what this means is the first 2 alphabets are actually long-term behavior change that go beyond COVID-19 itself. Hand hygiene is good for all infectious diseases, while coughing into your elbow is respiratory etiquette generally that prevent other infectious respiratory illnesses. And we are entering rainy season, and you find out that there are other diseases that cholera, and then as well as other respiratory illnesses, and we may also have that these can also prevent us from. But we are moving from the mode of action to behavior change. And then these are interventions that have been proven to be very cost effective. So what the campaign has done is the government of Nigeria is working collaboratively with United Nations Nigeria, all the UN agencies in Nigeria. They come together, and then from the US basket funds, part of it is devoted to support this behavior change campaign. And then they engage a consultant, that's CCSI, that has been working with state and national stakeholders to co-create the campaign materials, the key messages, which has been tested in the communities. And the media launch was done yesterday because media partners are very strategic in disseminating this message to the people. More importantly, the school communities, the students, there is Captain Bubble, it's something that looks like cartoon jingles that the children would like, that can resonate with them, and they will be able to reinforce these messages. So all sectors are encouraged to embrace this, And then we know that the campaign against COVID-19 and other infectious diseases is something that we all have to own, and we all have to make sure that we practice this behavior.
Well, Dr.
And then we make sure that everybody that need access to this and utilize this have access to them.
Just on a final note, I mean, we're 15 months into this fight, battle, if you may. There's a high level of COVID-19 awareness among the general population. But like you said, this is not matched with the positive preventive actions. And there are a lot of reasons. You mentioned pandemic fatigue, but there's also low risk perception and lack of trust in the government. Does this campaign deal with any of these factors?
Yes, the messaging is one part of the campaign, then the delivery is another one. And there is a community engagement component of the campaign, engaging the socio-cultural groups, relevant stakeholders, to see how they can hold this and then begin to translate this into actions in the household where everybody will begin to take responsibility. We know that lack of trust actually predates COVID-19 existence, and it is not just about Nigeria, it's a global thing, but this is the reality we have to deal with. And then we continue to engage our people for all of us to understand that we're all in this together. And COVID-19 virus cannot be smarter than human being. But if all hands are on deck, definitely we will be able to gain control over this. So we'll just continue to talk to our colleagues, our friends, families, and to continue to do the needful.
Well, it's interesting you mentioned that some of these measures are long-term, some short and mid-term. So clearly, this conversation is ongoing. But I'd like to thank you so much for sharing your thoughts with us. Dr. Yaya Dizu is Head Risk Communication at the NCDC. Wish you the best.